At the outset, good morning. At the outset, I'd like to thank Dr. Abhishek Kothari, my friend, to give me that opportunity to talk about inflammatory venous occlusions. I see a lot of Eels disease patients, and this is one kind of inflammatory venous occlusions. And I'll be showing you the Eels, sarcoid, BEHCET'S, and SLE. In case of retinal vasculitis, you see that first stage is the stage of inflammation, followed by the stage of ischemia. Third stage is the stage of neovascularization. Fourth stage is stage of complications. You get in the stage of inflammation the vascular occlusion. What is the pathophysiology? Is a focal, segmental, diffuse retinal perivascular proliferation of lymphoplasmacytic infiltrate. These subsequently lead to the occlusion of the retinal vasculature, subsequently retinal ischemia and capillary non-perfusion, and ultimately to the retinal neovascularization, hemorrhage and its complications sequelae. Okay. Periphlebitis is much more common than the periarteritis. Eels disease is the most common retinal vasculitis in Indian subcontinent. And here you can see that vascular venous inflammations, and if you see the vein wall surrounding it, the inflammatory cells, this is an histopathologic evidence of retinal vein inflammation. And you can see that this inflammatory cellular infiltrate can cause occlusion. Common type is primary associated with the Eels disease, associated with uveitis. These are the vasculitis are seen, various forms. Associated with the collagen disease, associated with the infection, associated with the neurologic disease like multiple sclerosis. Where is the site of inflammation? Arteries are arterioles, SLE, polyarteritis nodosa, acute retinal necrosis. Predominantly vein, Eels, multiple sclerosis, BEHCET'S, sarcoidosis. And arteries and veins both are involved in toxoplasmosis, venous granulomatosis, frosted branch angiitis, and Crohn's disease. This is an example of Eels disease. You can see the mid-periphery is involved with the retinal vessel inflammations as well as the occlusions leading to the retinal hemorrhages. Henry Eels first described in the 5 young men, but which has subsequently been changed, and now we see the primary retinal vasculitis of unknown etiology. He is described that retinal hemorrhage, constipations, and epistaxis. Healthy adults 15 to 40 years, predominantly male, mostly seen in Indian subcontinent. In Sarcoidosis, once we used to see 1 in 135 ophthalmic patients with Sarcoidosis. It now reduced. It has got a characteristic natural course. What is the natural course? First stage is the inflammations, second stage is ischemia, and then the neovascularization and fibrovascular proliferation. This is the hemiretinal vein occlusions, and you can see the upper trunk is involved. You can see the capillary non-perfusion. This is that Whitefield angiogram, and you can see the capillary non-perfusion at the periphery. Is obliterated perivasculitis, predominantly vein, diagnosis of ischemia, retinal edema, periphlebitis, peripheral non-perfusion, neovascularization. Recurrent vitreous hemorrhage with ensuing contraction and retinal detachment can follow. This has got strong association with the Mycobacterium tuberculosis. Capillary dropout, new vessels, laser photocoagulation, frequent vitreous hemorrhage, may require a vitrectomy or laser photocoagulation. Intravitreal injections, anti-VEGF and steroid can also be given. Common retinal vasculitis which mimics Eels disease are sarcoidosis, BEHCET'S disease, and tubercular retinal vasculitis. Major and minor criteria for the diagnosis of BEHCET'S disease: HLA-B51 may be positive, skin lesions seen in 90%, genital and mouth ulcers in 79.8%. This has been described as early as the 18th century, and even before that there is a description of there. What is that study group is at least recurrent oral aphthous ulcers, genital ulcer, ocular inflammation, skin involvement, positive pathology test. Complete type 4 main symptoms, incomplete type 3 main or 2 mains or 2 additional symptoms, typical ocular lesions and another main symptoms or 2 additional symptoms. Others are called BEHCET'S disease suspect. So you can get ocular disease, neurobasets, aphthous ulcers, angiobasets, skin lesions, deep venous occlusions, arthritis. So recurrent aphthous ulceration, skin lesion, genital ulcer, recurrent anterior and posterior uveitis, minor criteria, arthritis, epididymis, vascular disease, intestinal ulcer, neuropsychiatric symptoms. And here you can see the oral aphthous ulceration, genital ulcers, erythema nodosum, and this is that balanitis and positive pathogen test. Ocular disease is bilateral, anterior uveitis. Hypopyon is usually mobile hypopyon, non-granulomatous inflammation and cyclic membrane and posterior synechia, and one can have other manifestations rarely. And here is an example of Behçet's disease, and you can see that mobile hypopyon. And here is that retinal vascular inflammation. It's not usually in the mid-periphery as is seen in the Eels disease, and there is a overlying vitritis can be there, and here is the macular involvement in a Behçet's disease. And you can see the significant vitritis in a case of Behçet's disease. Retinal disease, recurrent retinal vascular-occlusive episode, retinal hemorrhages and edema with vitreous inflammation mimics ERM. FFA capillary dropout. I will show you the FFA picture. This is a Behçet's disease with retinal vasculitis. These are the other ocular manifestations of Behçet's disease. And here you can see the capillary farning. Is a capillary farning of that one in the like farning like inflammations over there. And you can see that this capillary farning is seen over here. Glaucoma, perivascular, particularly angle closure, iris neovascularization. These are the complications, retinal atrophy, optic atrophy. Vitreous hemorrhage rarely. Can mimic sarcoidosis sometimes. And immunosuppressive agents is the first choice. Now biologics has emerged as a new and promising therapy. Now coming to the next one is the systemic lupus erythematosus. There are several ocular lesions as well as neurological, renal, hematological disorders, and ANA is positive, particularly anti-DS-DNA. And here is you can see that malar rash and cottonose spots and retinal vein occlusions with retinal hemorrhages. Anti-DS-DNA is positive. Ocular manifestation, discoid lupus erythematosus of the eyelid, keratoconjunctival sicca, episcleritis, lupus retinopathy, we call it. And here is another form of inflammations is the frosted branch angiitis, where both the arteries and veins can be involved. Tubercular retinal vasculitis can produce frosted branch angiitis in one of the patients due to the tuberculosis. And here you will see the heel tuberculum of the choroid. And you can see that with the anti-TB treatment and steroids, there is a complete resolution of inflammation. PCR positive tubercular retinal vasculitis has been described by Amod Gupta group. 13 patients aqueous or vitreous was positive for MTB by PCR. And here is a frosted branch angiitis due to CMV retinitis. You can see that retinitis and the veins and arteries are involved. CMV retinitis with retinal vasculitis. Acute retinal necrosis, it can be due to the HSV, VZV or CMV, and here also one can have retinal vein occlusion. Discrete areas of peripheral retinitis, confluent areas with scalloped margin is seen in the late phase. Sarcoid uveitis can present with iris nodules, large Martin fat KP, Tachi di Borghi, vitreous and snowballs, and candlewax dripping. And they can have the retinal vein occlusions, as is mimics like Eels disease. Sarcoidosis, the systemic or disorder multi-organ disease characterized by lupus erythema nodosum, lupus pernio. And here you can see that candlewax dripping, patchy infiltrations of the retinal vessel inflammation. This patient had CNVM also. So take-home message, periphlebitis is more common than periarteritis. Their causes of venous occlusions are multifactorial. Both local and systemic autoimmune disease have been contributing factors. Inflammatory venous occlusion can be the first sign of a systemic disease. Eels disease mimics similar ocular and systemic disease. Biologicals are promising therapy in treatment of Behçet's disease. Thank you very much.